Hi everyone, welcome back to Whitecoat Medicine Talks. This is Carlos Ornedo, family practitioner from Laredo, Texas, talking today about hormones, specifically female hormones. It's a very broad subject, and we have plenty of patients that come in about, I feel bad, I think it's related to my hormones, and you know what, most of the time they're correct. So some of the problems that we see is, for the female, the main hormone that she has is estrogen, and it's so important that we want to try to keep a balance of the hormones. Unfortunately, as we age, we reach a point where we had so much hormones throughout our lives that eventually it subsides. And so you start, seeing patients that come in with various symptoms, such as, I can't sleep, I have a little bit of anxiety, I just feel very tired, my skin feels, saggy, or I feel like I've got more wrinkles. Complaints of, headaches, and, the most common things that we hear is the hot flashes for women. So there's quite a bit, an array of symptoms that when you are losing estrogen, and it is during the menopause stage, which the average age of menopause is somewhere between 46 and 52, and so that's where you're going to have your symptoms. And I recommend those that are seeing this video that they talk to their physician for proper management of those things. But let me just broadly give you some important things about estrogen. It's just amazing. It's got about 400 functions, okay? So some of them are: increases your metabolic rate, it has effect on your skin, the collagen, it helps decrease cardiovascular disease, and some studies about 40 to 50%. So it's just very important. It helps people with their memory, with their fogginess that they may be feeling. Their muscles are improved with estrogen. And so some of these things are obviously very essential. On the other hand, if you have too much estrogen, we have just the opposite problems. You will have, cardiovascular problems. You will have, metabolic problems. You will have problems like with plaque on your carotid arteries. You will have bone problems like osteoporosis and dementia. So as you can see, there's this balance that has to occur with the hormones. And so the question is, why or should I consider hormone replacements? And those are important things. And as we were talking about the function of estrogen in our bodies in females, we see that if your quality of life isn't as good, if you're feeling fatigued and tired all the time, your skin is an issue, you have cardiovascular disease, osteoporosis. So there's some reasons of being able to try to use hormone replacement. Of course, if you have cancers such as uterine, history of breast cancer, even family history, those are some of the reasons that those are just going to be things you cannot, would be even consider taking. And again, those are things that your family practitioner or OBGYN can give you more details on. But it is broken down into three types of estrogen. You have E1, E2, E3. And so estradiol is a predominantly hormone that is probably during the reproductive age of a female. And then we have estrone, which is predominantly during the menopausal times, or premenopausal times for a female, and estriol, which is probably the least of the three, probably the safest of the three. And so it's just a very hard balance. And so those are questions that one will ask for females. I will go into more details about specific things with estrogen itself that we can discuss and see if you can understand why it would be important to consider hormonal replacement. We'll talk to you soon.